This is Dr. Corey Maas on Looking Your Best. Today we're discussing, relative to a couple of patient questions, the options for using cosmetic injectable fillers around the eyes. And it's an area of definition where we describe the deep sort of linear depression under the eye that extends from the corner downward toward the cheek as the nasojugal groove, or the tear trough depression it's often described as. And really, when we look at that, it is a combination of the sinking of the cheek mound, the area of the cheek here that descends with age toward the upper lip and thus creates a deeper fold, loss of volume, and in addition, the protrusion, or pseudo-fat herniation, as we like to describe, of the lower eyelid fat pads. So it can be any one or all three of those in combination that creates this linear tear trough under the eye, and that is part of the dark circle complex, which I've talked about before, and I've written some book chapters, and I certainly invite you to look at my publications on that if you just look up dark circles and Dr. Maas. And because dark circles are complex, and a big part of dark circles is the tear trough depression, wherein the shadow, either caused by the brow or the eye itself, or more importantly, the lower eyelid fat pad, that shadow effect makes that dark circle effect much darker. Now, there are other contributions to the dark circle, which include networks of vessels, theoretically hemosiderin deposition, which is a sort of hemoglobin byproduct, and of course just melanin, our normal pigment that happens genetically in that area, and we don't know why, but all of those have specific treatment indications. I think the easiest and first steps in improving that dark circle under the eye, or the depression, is the treatment using cosmetic fillers for the tear trough depression. An immediate result is achieved wherein people look less tired, and when people come in with a tear trough depression, their chief complaint is usually not to look more beautiful. It's that people always ask me, why do I look so tired? And the immediate effect is by lifting that up, getting more light shining on that deeper depression, it looks less dark and you look less tired. So that's something that's done with a cosmetic injectable filler. There's a couple of preferences that I have where the fillers hold less water, and I think that's very important, knowing the distinctions between these different fillers, because there are subtle differences in their water retaining capacity, which around the eye becomes a very important part of the decision tree. We don't want long-term water retention there, because your eyes can look permanently puffy even with the filler there. So again, choice of fillers is key, and placement accuracy is also key, because the duration of effect in this area, when it's placed correctly, and that's just below the muscle, just below the covering of the bone, the periosteum, which is relatively avascular, so there's not very commonly bruising, and it's very comfortable, frankly. Most people are surprised that with a topical anesthesia, you really can barely feel this treatment. So when we treat that tear trough depression, it's something you do in the office. We do numbing for 30 minutes or so that it's comfortable. If you're really needle phobic, we'll use a little laughing gas, which makes it even more comfortable. And I'll do those injections in small aliquots to correct or elevate the depression. And the primary area, again, is that sort of diagonally oriented tear trough depression. Now, in many patients, as I said before, this is a combination of the sinking of the cheek mound along with potentially protrusion of the fat and loss of volume. And in many patients, the outside part of the eye is also kind of a hollow area, especially if there's prominent fat pads. That's what we call the orbitomalar groove, or the eye-cheek groove, and it's a benefit to lifting that up too in those patients where the eyes are defined by a whole semicircle underneath the eye. And by treating both the tear trough depression and the orbitomalar groove, we're relieving that sort of underlying dark circle effect, which again primarily is about making you look tired. It's a beauty event for certain, but really it's about making you look fresh and more alert and less weary or tired. So in most cases, the tear trough depression itself is going to be a big benefit. And again, specific fillers that are not water retaining are important to use in that area. Same holds true for the orbitomalar groove. And the last area for augmentation or improvement around the eye with cosmetic injectables is up around the eyebrow and in the infrabrow area, just below the brow and under the brow. In many patients, we can do small amounts of augmentation and in effect a slight brow lift by doing so. We don't want to do too much augmentation above the brow, and certain patients really can't tolerate it given sort of a Neanderthal look with the forehead being too prominent, particularly in women. But in most, we can do small augmentation along with the botulinum toxins that can help to lift the brow and get better brow position. So those three zones in cosmetic injection areas are really very important. They're things that can be done in the office. They're often done in combination, as I mentioned, with botulinum toxins. They're done with fillers, as I said before. And then there are non-invasive approaches such as ultrasound, often referred to therapy, focused ultrasound therapy, which can do brow lifting, as well as other radio frequency devices that can give limited in scope but beneficial brow lifting effect. Those areas are the non-invasive approaches for treatment around the eye with fillers, and those non-invasive approaches are great tools to have along with our surgical options like blepharoplasty, lower eyelid blepharoplasty with the transconjunctival or no incision approach where you don't see any scar behind the eyelid, a brow lift which can be done with a small suture technique, temporal brow lifting, or endoscopic using a small lighted telescope. All are options on the more surgical side, but those non-invasive options are great for many patients to help to reduce the tired look, elevate the brow, and keep you looking your best. This is Dr. Corey Maas on Looking Your Best.